Today we have with us Dr. Binder Singhal, pediatric urologist. Dr. Singhal specializes in urological problems in children. Today he will tell us about hernias in children, their causes and complications. He will also talk to us about the treatment options available to your child.
Hernia refers to a swelling near the testis. It occurs because there is a defect in the muscles through which the intestinal contents and contents within the tummy bulge out. So whenever the child cries or whenever the child is exerting himself while playing or something, we will notice a bulge just above the testis. This condition is called hernia. It is very easily picked up because the diagnostic feature it will happen only when the child is crying or the child is playing or pushing or coughing. These are the signs of hernia. Hernia in children results from a weakness of the muscles right from the time of birth. Normally the testes, they pass through a hole in the muscles to come down to their normal position. If that hole does not automatically close by itself after birth, then that is the area of weakness through which the intestines and the other tummy contents can herniate out and form a clinical hernia. The common hernias which we see in children are inguinal hernias and umbilical hernias. Inguinal hernias occur near the testes, while umbilical hernias occur near the belly button. Hernia is very easily diagnosed because most of the time parents will be able to tell that the child has a swelling either at the navel or it has a swelling at the site of the testes. And the diagnostic sign is mainly these swellings will occur when the child is coughing, playing, or the child is crying. A hernia in a child, especially an inguinal hernia which occurs near the testes, always requires surgeries. Sometimes these child may be absolutely newborn babies like 1 kg or 1.5 kg babies. Even they will need to be operated for hernia because an unoperated hernia can sometimes get stuck and lead to emergency surgery, which is always always more major and complicated than a planned hernia surgery. So whenever the hernia is diagnosed, we advise the parents and the caregivers to go ahead with the planned elective surgery as soon as possible. Hernia surgery is a daycare surgery. The children come to the hospital in the morning after 6 hours of fasting. Surgery takes typically 30 to 40 minutes and they're able to go home in the evening and play around. There are no stitches put, all the stitches are within the skin and there is a very, very fast recovery indeed. Out of all the hernias which we see in children, 90% occur in boys, only 10% occur in girls. Children who are at a risk of developing the hernia are typically babies who are born ahead of time, premature babies, babies who have intestinal obstruction, babies who have muscle weakness because of other reasons like cerebral palsy or other anatomical defects within the tummy, or children who have undergone other kinds of surgeries in the tummy. Hernia is a condition which results because of a weakness or a defect in the muscles. Because of that, there is a weakness of the abdominal wall. Hernia should always be operated because a hernia can get stuck in the emergency and it can lead to a major complicated surgery. So that is why a hernia should always be operated whenever diagnosed. So when the hernia gets stuck, there will be tremendous amount of pain which the child will have. The swelling will become red, the tummy gets swollen and there is incessant vomiting in the child. These are the signs of a stuck hernia or a hernia in which the intestinal loop has been trapped. So that is why hernia is an elective surgery and should be done early.